Welcome to Metaviews. Nootropics, exciting new frontiers with natural health products for cognition.
Okay, hello, I'm Professor Stough, and I'm here with Professor Andrew Scholey. And today we're going to talk about nootropics as part of our Metaview series of videos. Hi, Andrew.
Hello. So, yeah, Con, what, I guess we should just start by outlining the basics. So what is a nootropic or a nootropic? I think there are different pronunciations.
Yeah, so nootropic derives from two Greek words. The Greek words for mind or intellect and altering or changing. But I guess a modern day definition of nootropic is any pharmacologically active substance that can improve our cognitive performance. And so, you know, cognition is itself quite a complex word. Most people associate cognition with memory or attention, but it can mean it can refer to many other domains as well. And of course, you know, there's different classes of drugs ranging from pharmaceuticals, for instance, to plant-based extracts, nutraceuticals. And I think all of these have the potential to improve our cognitive performance.
Yeah, so I guess this is an area that's developed out of the pharmaceutical drug development pipeline. So what are some of the main pharma type of cognitive enhancers?
Yeah, I think there's a long history of people experimenting and using pharmaceuticals for cognitive enhancement, sometimes with diabolical side effects and big safety issues. But the really common ones at the moment, I think, are amphetamines and amphetamine type substances such as Ritalin that purport to improve things like working memory and attention. There's another pharmaceutical called modafinil, which is quite widely used, which is used for prescriptions related to narcolepsy, but seems to increase attention and reduce fatigue over time. And then, of course, there are really commonly used over-the-counter type of substances such as caffeine. Nicotine might also be a nootropic as well. And they're the sort of the pharmaceuticals that are sort of mainly used at the moment, I think. And they're obviously different than nutraceuticals, which are, I mean, the nutraceutical supplement industry is huge. And I think one of the really exciting things in this part of the industry is designing new nutraceuticals or plant-based extracts or combinations of these that can improve cognition. So what do you think are some of the nootropics from that part of the market, Andrew?
Well, where do we start? I mean, both of us have done a huge amount of research in this area. Firstly, identifying cognitive enhancers from natural products and then putting them to the test. Some don't make it, many do. And I guess within the ones that have got some reasonable evidence are compounds that we've talked about. So things like Brahmi, Bacopa, which we did a Metaview on, the cocoa polyphenols, which again, there's a Metaview on that. Also substances like ginkgo biloba, which I think is probably one of the most widely known natural cognitive enhancers. I'm not sure how well the evidence, the initial promising evidence, has actually developed over the years. Substances like ginseng, curcumin from turmeric, ECGC in teas, sage, lemon balm, guarana. There are huge numbers, and I've probably missed out many more than I've included there.
They all work slightly differently, don't they? I mean, the mechanisms of action are completely different. So there must be multiple targets for cognitive enhancement.
Absolutely, and I think this is really really fundamental to the research that we have done, are doing, and that we advocate, because the idea, I think, from the usual drug development pipeline for the brain is that you have a substance which can enter the brain, and then it has a very specific effect on a single neurotransmitter receptor or class of neurotransmitters at the most, and that, you know, when you do that, you throw a lot of things out of balance, unfortunately. So when we look at things like, say, the cholinesterase inhibitors, which it's usually described as propping up this neurotransmitter acetylcholine in the brain, it can improve some of the symptoms of things like Alzheimer's disease, but it also has a number of side effects, because every neurotransmitter has multiple effects in the brain. The natural products, cognitive enhancers, tend to affect multiple systems in quite subtle ways, or instead of just slamming single processes, they sort of nudge multiple processes in one direction. And these
so more than one mode of action. So a pharmaceutical might affect a certain biological target, but nutraceuticals might have multiple.
Yeah, so things like glucose control, cardiovascular function, blood flow to the peripherally, but also to the brain. Things like the stress hormones like cortisol, tweaking the bacteria and the gut microbiome, all of which we know can influence cognitive function. You talked about caffeine, and we'll do a Metaview on caffeine separately, but that's a really interesting case, because to identify, it's I think the most widely used psychoactive substance, and I remember, I don't know if it's still the case, but certainly quite recently it was I think the second most traded commodity in the world after oil. And one of the things about caffeine that people are familiar with, it will give you that lift, and it is a kind of prototypical cognitive enhancer, but it also has a downside in that, if people take too much, they get this jittery, anxious feeling, and part of that is to do with its mechanisms of action. So it's sort of, as well as having this chemical boost for cognition, it also actually restricts blood flow to the brain. So so that's not a great thing for cognition. And then I guess the other thing which I know that you're very interested in is the idea that there may be different mechanisms involved when we look at natural nootropics for acute enhancement versus chronic enhancement.
So what's the difference?
In terms of the mechanisms, or
so what does it mean to enhance cognition acutely versus chronically?
That's a great question. The acutely, we just mean something like caffeine, where you take a single dose or drink or beverage, and you expect to get the effects immediately following that, in the sort of minutes, hours following it. Chronic effects are ones which develop over time, so they may not emerge till weeks or months after daily ingestion of a certain substance. And I think that probably the mechanisms are different. So mechanisms for acute enhancement probably include things like improving blood flow to the brain, and maybe some direct neurotransmitter effects. I know you are very interested in more of the chronic effects. What are some of the main mechanisms there, would you say?
Well, I think the chronic enhancement is really interesting in our sort of societies as we're all getting older, and we're all living to much older ages, and we know that there is a reduction in cognition with age. Age-associated cognitive impairment. For a big part of the population. So, I guess the chronic enhancers are trying to map onto some of these age-related biological changes that are associated with changes in cognition. So, these could be changes in oxidative stress, these could be changes in inflammation, changes in blood flow, changes in oxygen, glucose metabolism, a really wide variety of different biological processes that are associated with increasing age. And so, I think we can, we can develop nutraceuticals or new nutritional products that try to map onto some of these biological changes with age that potentially could ameliorate age-related cognitive changes, and maybe even protect against non-normal or abnormal age-related cognitive changes as well. So that's sort of the holy grail. And I think it's a really exciting new area for the population and also for industry working in this area.
That's really interesting. I think particularly when the mechanisms that you've just articulated don't really seem to be the targets for the pharma industry. I wonder why that is.
Well, I think age is not a disease, is it? So it's hard to develop pharmaceuticals for things that are not a disease state. Whereas over-the-counter supplements are perfectly matched for just small variations in functioning with age, and that's why I think the nutraceutical industry is in a great position to develop products in terms of chronic nootropics or chronic cognitive enhancers. I mean, look, even I think it's really important to keep up with research coming out of neuroscience, because we're learning things every day, I think, about how the microbiome changes with age and how that affects brain function. One of my students has finished a really interesting study on combining Bacopa with cognitive training and looking at things like synaptogenesis. So how do neurons talk to each other, and can we create new connections of neurons using nootropics? And so there's a lot of research in that area being done at the moment. So, I think we're discovering new pathways, biological pathways to improve cognition all the time. So keeping abreast with neuroscience research, I think, is really key in developing new supplements in this area.
Absolutely. And I think, even sort of older techniques are always evolving, and including things like, for example, neuroimaging, which I know we've both been very excited about being able to apply neuroimaging to some of the trials on natural products for the brain. I guess the other thing it's worth thinking about, you mentioned the industry side of things, is there is huge potential here, I think, just in terms of a kind of business model in terms of developing nutraceutical or natural products. I mean, it could be a new combination of natural products for brain function. And one thing that always strikes me, and something I know that we've talked about a lot is the idea that the kind of drug development pipeline is a little bit easier in this space because the safety and tolerability is often really well established. So, we know that there are effectively, hundreds or even thousands of years of field studies effectively showing that these substances are safe. So it's really the clinical trials need to be focused on efficacy. And once we get past that hurdle, then we can use the evidence base to help to get them to market.
Yeah, you can really bypass phase 1 and phase 2 trials. How you can really go straight to phase 3 efficacy trials with plant-based extracts or nutraceuticals.
Yeah,
it'll be interesting to see if that also applies to the substances that affect the microbiome. So things like probiotics, for instance, when we develop new mind-brain cognitive enhancing probiotics.
Yeah. Now that's an interesting. I guess it's the new frontier, and let's see what happens in terms of the trials. Which, I guess my take on it has been that the animal work is really compelling. We really need to see some well-controlled human trials now.
Yeah, they're just lacking at the moment, aren't they, for cognition? We always, just to sort of finish off maybe, but we always talk about the difficulties in consumers finding the right products and using an evidence-based methodology, I guess, to select the right type of nutraceuticals. So, if I wanted to find a nutraceutical that improved cognition as a consumer, how would I do that, Andrew?
That's a really interesting question. It's a big question. I think there isn't really a reliable repository of good evidence-based research in this area that I know of, and of course that's one of the ambitions of Metaviews to establish something like that. Wherever possible, I think it's important for consumers to check the evidence, and my advice is always to, when getting a supplement, is to try and source the supplement that the studies have been performed on, because that has for two reasons. The first is that you are then using the actual supplement that's shown to have some sort of efficacy, because if you look at something like Bacopa or curcumin, even sort of B vitamins, which are fairly generic, the quality can vary a lot from bottle to bottle, and there's lots of evidence, lots of publications on that. So you're actually using the one that the study's been done on. And then the other side, I think, is just that you are supporting the companies who are prepared to put the money where their mouths are and actually support clinical trials rather than divert that money into just marketing, for example. And don't forget, as well as this Metaview, there will be a blog post or a white paper on nutraceuticals for the brain. And if you've got, well, thanks for watching. And if you've got any other suggestions for other Metaviews that we can talk about, please let us know.
Thank you for your attention. For more information, visit metaviews.consulting.